Good afternoon, it's Thursday, October 29. I'm Herman Green with your midday news. If you're watching on onespotmedia.com, a special welcome to you. The Ministry of Health has ordered 2 nursing homes to be closed for not complying with regulations under the Disaster Risk Management Act. These facilities are located in Manchester and Hanover. O'Shade Masters has the details.
Concern has arisen over the state and care of the elderly and other persons in state care following an outbreak of the respiratory illness COVID-19 at the Golden Age home in Vineyard Town, St. Andrew. It has led to many asking why there was not better protection of those individuals by the government. However, since then, the Health Minister says inspection of a number of state facilities and nursing homes have been carried out. The details of those inspections were provided at a Jamaica House press briefing last evening. Health Minister Dr. Christopher Tufton says 236 facilities were inspected, to include 203 nursing homes, 13 infirmaries, 14 children's homes, and 6 rehabilitation institutions. Of the nursing homes, 99 were found to be compliant with the COVID protocols, so too 7 infirmaries, 4 children's homes, and 2 of the rehabilitation institutions.
2 nursing homes, one in Manchester and one in Hanover, upon inspection were ordered closed, and the others have been served notices under the nuanced regulations and given up to a maximum of 30 days to become compliant.
Dr. Tufton noted that of the 106 prisons and lockups island-wide, 43 have been inspected.
So far, with 12 meeting the COVID-19 standard, while the other 31 have been given a timeline within which to become compliant.
Now, as for the Golden Age home in Vineyard Town, St. Andrew, he noted that testing of the residents and staff members is now complete.
Of the 620 residents and staff members tested over the 3-day period, 87 results have returned positive for COVID-19, while 553 were negative. The 87 positive cases include 65 residents and 22 staff members. All the positive cases remain stable, and that's good, and asymptomatic, except for the first case, who unfortunately has since died.
The Health Minister says subsequently a meeting was held with the management team and a cleaning service provider to outline the corrective measures to be taken at the facility. He also noted that daily visit by medical officers will continue to ensure the positive cases are isolated appropriately and they are monitored closely. O'Shade Masters, TVJ News.
Meanwhile, local government minister Desmond McKenzie says his ministry has increased surveillance of all infirmaries. Speaking at the Jamaica House press briefing last evening, Mr. McKenzie said a number of protocols which were implemented several months ago still remain in place. These include no new admissions and no visitation. He, however, said based on requests from some relatives, a program is being looked at to have some level of visitation.
We are presently devising a program that we are going to be sharing with the Ministry of Health shortly that will put us in a position to create some avenue for visits that would not take individuals into the infirmary itself, but something like a drive-through or something that we are presently working on. And once we have concluded those arrangements, we will share it with the Ministry of Health and try to make it possible.
Mr. McKenzie is, however, reassuring Jamaicans that his ministry is on top of the situation to ensure the residents at the island's infirmaries are safe.
We are putting in the necessary infrastructure, providing the resources to ensure that we continue to provide and make the infirmaries conducive. I want to assure the country that the government is on top of our infirmaries. Despite the slips that occurred at the Vineyard Town facility, we must commend the staff of the infirmary for the work that they have been doing to keep our infirmaries COVID-free.
Local government minister also noted that they will be seeking to ramp up testing at the island's infirmaries. A public health expert is calling for vigorous contact tracing after a resident of the Vineyard Town Golden Age home in St. Andrew died after contracting COVID-19. Anthony Lugg has the details.
Most of the residents at the Golden Age home are considered a part of the vulnerable group, so it's no surprise anxiety was high when news came about the COVID-19 cluster at the facility. The health ministry has since rushed to strengthen protocols to tackle the outbreak. Our news team has been informed that at least one resident who tested positive has died. On Wednesday, news came that a resident of the St. Elizabeth Infirmary also died from the respiratory illness. Local Government Minister Desmond McKenzie confirmed the deaths in an interview with our news center.
Well, it is unfortunate that the first individual who contracted the virus at Vineyard Town has died. There is another death that has occurred, and that is of a resident who was admitted to the Black River Hospital. He was placed in isolation, and a COVID test was conducted on him on the 7th, and on the 9th the test came back positive, and he was removed the same day from isolation and was placed back in the Black River Hospital, and he subsequently died.
Residents who test positive for COVID-19 at the Golden Age home are in isolation at the section of the facility where they reside, while the staff members are in home isolation. Public health specialist Professor Winston Davidson says the death at the Vineyard Town Golden Age home requires an urgent response from the health authorities.
If somebody in the Golden Age home died, then it means that somebody has infected that person from outside. In other words, one of the persons who has served in that particular home. It means that what is going to be necessary is that you need to do the necessary testing and of course, to determine exactly who is positive. So there are other persons in the Golden Age home that are positive, and try to start with contact tracing, try and see exactly where this person comes from.
Anthony Lugg, TVJ News.
And Jamaica's death toll from COVID-19 has passed the 200 mark. 4 deaths were recorded yesterday, pushing the tally to 202. They comprise a 45-year-old woman from St. James, a 34-year-old man and a 90-year-old man from St. Elizabeth, and a 38-year-old Westmoreland woman. The Ministry of Health says 2 more deaths are under investigation. In the meantime, the country's COVID-19 case count has increased to 8,927. 76 new cases were recorded yesterday. Their ages range from 1 to 95 years. The Health Ministry says 109 patients remain hospitalized. 4 of them are critically ill. A controlled relaxation of the COVID-19 restrictions is expected for the Christmas season. Prime Minister Andrew Holness said during the period, greater emphasis will be placed on personal responsibility. He explains that in order to ease restrictions for the festive season, the measures implemented will remain until then.
One of the reasons why we decided to keep the measures as controlled as they have been is so that for the Christmas period that we can have a loosening, let me take back that word, that we can have a controlled relaxation of the measures. So at least for that period. So it all depends, of course, on what the numbers are saying now. So if we keep the measures faithfully in compliance, it is likely that we should be able to have a controlled relaxation of the measures during the Christmas period.
And strict guidelines will be implemented for the advent of drive-in cinemas, which are slated to officially become operational on November 1. Local Government Minister Desmond McKenzie made that announcement on Wednesday.
We're going to be engaging the operators of the drive-in cinemas to ensure that the strict protocols surrounding how many persons can be in a motor vehicle will be worked out, but to give notice that we have sanctioned and will be working for the establishment of drive-in facilities for a certain level of entertainment.
Theaters and cinemas have been adversely affected by the COVID-19 protocols, including restrictions on gatherings and the nightly curfew. Mr. Mackenzie is also reminding citizens that the ban on nightclubs and parties is still in effect. He says persons who fail to adhere to the ban will face the consequences.
The security forces will be enforcing, and we are presently working to make adjustments to the Disaster Risk Management Act to make breaking the offense one that persons will regret.
And there's a possibility that more beaches or rivers could be closed due to breaches of the COVID-19 protocols implemented by the health and local government ministries. Minister Mackenzie sounded the warning last evening.
We have noticed within the last 3 weeks or so that some of those beaches that were operating within the guidelines that was set out by the Ministry of Health and the Ministry of Local Government are violating those protocols. And we are reviewing what is presently taking place at those that are operating outside of the guidelines.
In August, Mr. Mackenzie ordered 36 beaches and 17 rivers to be closed. This included the popular Helsha Beach in St. Catherine, Little Duns River in St. Anne, and the Spanish River Bridge on the border of St. Anne and St. Mary. And we now take a break here on the Midday News, but stay with us. We have more news when we return. Welcome back, continuing the news. The Association of Principals and Vice Principals has labeled as timely the decision by the Education Ministry to have a phased implementation of face-to-face classes. The association says it comes at a time when teachers and students are faced with a myriad of issues, chief among them, no internet connection. Details in this report. Jamaica House press briefing Wednesday evening, Education Minister Favour Williams announced the plan to physically reopen schools on a phased basis for the 2020-21 school year.
We intend to allow for the phased resumption of face-to-face classes in some schools for the academic year 2020-2021. The phased resumption will be done in accordance with Order 14 of the Disaster Risk Management Act. Based on the proposal, the current approaches, which is the online, the audiovisual, and the learning kit, will continue to be available for all schools.
It's a move favored by Principal of the Tarrant High School, Paul Hall, who is also second Vice President of the Association of Principals and Vice Principals. Acknowledging that COVID-19 is here to stay, Mr. Hall says students should not be left to suffer because of the virus.
It's a long time now, and so I agree with the fees basis. So certainly we're expecting other schools to come on board shortly, because a lot of the students are suffering.
His recommendation is to use the model that was implemented for students who sat the CSEC and CAPE examinations in June this year, where face-to-face classes were conducted.
And I'm saying there was no evidence to speak to the fact that there was a marked increase in COVID cases because of that interaction, face-to-face. So the virus is here. We don't have any solution right now in terms of even the time frame. And so we have to live with it. What we have to know is how we manage and how do we navigate the way around it.
In the meantime, Mr. Hall says a discussion with other principals around the island will be held shortly to hear their concerns and recommendations. But for Education Minister Favour Williams, a number of measures will be looked at before the 17 schools which will open on a phased basis are selected.
In terms of the protocols, students coming to school for the face-to-face must wear a mask, and we're asking principals and teachers not to deny access to students who show up in masks that do not match the school's uniform. The important thing is that students show up in masks. And if a student do not show up in a mask, one should be provided. I must emphasize the importance of the adherence to the COVID-19 protocols, such as temperature checks and logs, hand washing stations, physical distancing markers, sanitizers at strategic positions, isolation areas with the necessary facilities, among others.
She also noted that the Ministry of Health will be pertinent in assessing the schools before students are allowed to return. And just a point of clarification there, Mr. Paul Hall was speaking as principal of Tarrant High School and not as a representative of the Association of Principals and Vice Principals. In other news now, Chief Justice Brian Sykes says the judiciary is working to ensure that judgments are delivered in a timely manner. There have been complaints that judges have been taking too long with rulings, with some even retiring before decisions are handed down. Justice Sykes responded to the concerns at a media forum this morning.
We identify when the judge is due for retirement. And from about 12 to 18 months before, we begin to manage the judge in a way that coming up to retirement, all the outstanding matters that the judge has will be completed before the judge goes into retirement. So that is how it is being managed administratively.
He says having more oral judgments is part of the fix for the lengthy delays in handing down decisions. According to Justice Sykes, how judges are assigned is also being reorganized.
That there was no time built in to the judge's schedule for preparation and delivery of judgments. So not many persons are aware, for example, certainly on the trial court, in the Supreme Court, a judge would spend 4 weeks in the criminal courts and they end on a Friday. Then they are gone out to circuit for the next 4 weeks. Sometimes they might have 2 circuits, so that's 8 weeks out. And so where would the judge get the time now? This would be on weekends and at nights. And some cases require a significant block of time to really come to grips with it.
The National Water Commission, NWC, says its revenue has been significantly impacted by the COVID-19 pandemic. NWC President Mark Barnett says the company has lost more than $2 billion in revenue since March this year. Mr. Barnett told a virtual media briefing this morning that large commercial customer usage has reduced due to the pandemic, which impacted the company's cash flow. Mr. Barnett says the company had to fork out large sums for trucking water during the drought, even as the commission was seeing a reduction in revenue.
For one period, our revenue would have dropped as much as 40%, meaning our cash flow similarly dropped by that amount. So you can imagine going through a drought, a COVID, and a need for increased delivery of water, which in our case at the time, it would have been through trucking. So my trucking bill went through the roof. My revenue is going south. And therefore, it is unquestionable that we have been impacted negatively by COVID. For the 8-month period, starting March up to the end of October, we would have lost in cash flow upwards of $2 billion in our revenue. So you would have understand how deleterious that is in terms of our operation.
The overall cost to repair the damage caused by recent flood rains could balloon even further, as a preliminary assessment of some of the damage in parts of Western St. Thomas paints a dismal picture. Krista Campbell has that story.
From 9 miles in Bull Bay to Windsor Forest in Western St. Thomas and several communities in between, the damage from the weekend flood rains is unquestionable. Landslides, falling rocks, breakaways, compromised bridges, damaged water pipelines, and communities left marooned. A team from the National Works Agency, NWA, toured some of the affected areas on Tuesday with Member of Parliament for Western St. Thomas, James Robertson.
I wouldn't want it to be billions of dollars. It's more than that.
The NWA says all the roads which had been blocked have been cleared and reopened to accommodate at least single-lane traffic, but the situation is still grim.
9 breakaways, and we have not gone into Cedar Valley Division properly yet. I'm in discussion with Minister Warmington for that tour. We'll be going into Cedar Valley Division to look at Mahogany Vale, Penn Line, Nest Castle, and coming down into the coffee lands, the Blue Mountain Hills. I'm expecting to see a lot more stress.
Communication manager at the NAA, Stephen Shaw, says at least 4 of the worst breakaways are being given priority attention.
We have roads, though, that have been bad discovered, such as that from Lloyds to Low Mountain. That will require some new material to be put on the road to facilitate easier passage. The challenge that we're having with that, though, is that the rivers are in spate, and so the material that we usually use, the river shingle, is not readily available.
He says once weather conditions improve, work crews will be able to access the river materials to do the repairs. Meanwhile, for places like Moffat, it's like walking on eggshells. The road reduced to a path almost too narrow to access by foot. A road our TVJ News SUV was able to drive on when we last visited in July this year. In a section of the community, residents are reportedly trapped because of landslides. Mr. Shaw says his agency is trying to address some of the damage.
We do have some challenge along the road from Bethel to Whiteford, and that too requires a special retaining structure, and that will be designed.
He says they will then do an estimate of how much the repairs will cost before sending the request for funds to the Ministry of Economic Growth and Job Creation. In Swamp Road and Riverhead, floodwaters caused significant damage to the National Water Commission's pipelines and left residents without the commodity. And there's worry about other infrastructure.
I'm very hopeful that the National Work Agency will be able to mobilize equipment to clean our gullies and our rivers so as to protect the structures, our bridges. A lot of our bridges are at risk now.
The MP says work had already started on a new bridge in Landui to replace the old one which has now failed. Krista Campbell, TVJ News.
And that's the midday news. Our next newscast is the primetime package at 7. Please join us then. On behalf of the News, Sports and Production teams, I'm Herman Green. Good afternoon.